Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health and the Center for Men's and Women's Urology, coming to you with another segment from Portland, Oregon. And we have talked about these things before, pelvic floor physical therapy. And for those of you all who have been on our website, you have seen my friend and excellent expert colleague, Tomiko Saldia. She is on our website. She's a master physical therapist, and she is trained in the McKenzie method. And I want for you all to meet her today so that you all feel comfortable sending her questions, perhaps working with her in the future, but also to just glean some of her expertise to know exactly what pelvic floor physical therapy can do for you and your pelvic health, because as we've talked before, pelvic floor physical therapy is something very near and dear to my heart and something that I use a lot of in my practice. I make a lot of referrals to Tomiko. As I said, she's on our website because she is part of 360 Pelvic Health Institute. So without further ado, I would like for you to meet Tomiko. And Tomiko, if you don't mind, tell our audience and our listeners a little bit about pelvic floor physical therapy, what it is that you particularly focus on, what your area of expertise is, and how you go about treating patients.
Yeah, well, thank you, first of all, for inviting me to be on this with you today. I'm sure that a lot of patients don't know what pelvic floor physical therapy is and probably have never even heard of it. So when they say, "Why do you want me to go do that?" What do you usually tell them?
I tell them that it goes along with their pelvic health, because a lot of pelvic health issues, whether it's a dropped bladder or a dropped rectal wall or painful intercourse, sometimes it's straining to pee or straining to have a bowel movement. Sometimes it's just chronic pain. That has a tremendous amount to do with what's going on with the bladder, with the bowels. So it's always nice to have good body mechanics and have the pelvic floor musculature in balance, because so many different things go into that. And it's like peeling away the layers of an onion. Lots of times patients don't understand, well, you sent me for pelvic floor physical therapy, but she's been working on my core, or we're working on my back. And it's because it's like peeling away the layers of an onion. You can't work on the pelvic floor without addressing the dysfunction elsewhere to get down to the core of what's going on.
Absolutely. That is absolutely true. So I'm going to say that probably 98% of the patients that you send me are actually suffering from some kind of chronic pain. And they may or may not tell you about it. I'm not really sure if they do or not. But when they come down, that's always one of the first things that I do ask them, is I ask them about their pain scales and what they're dealing with. And many of them don't really understand why I want to know about what's going on with spinal mechanics and why am I testing their spinal movements when they're there for pelvic health physical therapy. So then I break down the education of anatomy and the nervous system, and how the top of the nerve chain that deals with pelvic health starts in the thoracic spine. So a lot of time, people come in and they have neck, middle back, and low back pain. And so I have to let them know that pain is definitely a disruptor when it comes to pelvic health. So one of the things that you know very well is that I might be one of the least invasive pelvic health physical therapists out there, because it's very common that when patients go to a therapist, the first thing they address is the pelvic floor. So they might do a pelvic muscular assessment, which, it's not an invasive assessment, but I think anytime we are going internal inside someone's body, then people, don't you think they naturally perceive that as invasive?
They do.
Yeah.
They do.
So I actually don't start there unless somebody comes into the clinic on the very first visit and they're expecting that. That is not the first thing that I start with when a patient comes in for pelvic floor physical therapy. So when I'm doing my initial assessment on them, I'm taking a very detailed history of all of their injuries and surgeries, and then also learning about their chronic pain, and they might be coming in with neck pain, middle back pain, low back pain, but that person might also have shoulder pain or hip pain or knee pain. and maybe they even have some kind of gait deviation that is affecting their pelvic floor. So I want to address all of those orthopedic issues when I'm working with patients, because any kind of abnormal movement that they have might have some kind of direct or indirect impact on their pelvic floor. So one of the reasons why I specifically focus on pain is because pain is inhibitory. When a person is dealing with chronic pain, then that pain is disrupting their nervous system, and it might be disrupting some of the nerves that innervate their pelvic floor.
Yes.
So by patients, I tell them right off the bat that I will not be doing a pelvic muscular assessment on you until I know that you have your chronic pain managed very well. And the reason why I do that is because since pain is a disruptor, if I start working immediately on their pelvic floor, their symptoms are going to keep reoccurring, and it's literally going to be a waste of my time and their time. So I want to make sure that patients really know very well how to use, like you said, proper body mechanics, proper postures. All the patients that come in, no matter who they are, everybody's got to work on their posture. And the most important thing is a movement assessment. So a movement assessment tells me where the source of their pain is coming from. And so based on that, I can develop a very specific home program for their pain management. And so once they are completely independent at doing that, if they still haven't gotten results with reducing symptoms, because many of the patients, I don't know if I've told you this, but many of the patients, just by treating their pain alone, their pelvic health symptoms disappear.
I've seen that.
Yeah. And even sometimes I have patients come in by even the second visit. And let's say it's somebody that has urinary urgency and frequency, and they're going to the bathroom every hour. I mean, there are times when just by doing some one or two key movements with their spine, they might come in the second visit and say that their symptoms are 100% better. But I don't stop therapy there. There's still more for them to learn. So they still might come for, a whole course of physical therapy, which I usually try to start people with 12 visits. But because there's still a lot of information that they need to learn about how to maintain this symptom reduction, how to continue working on their pain management, and then also, too, just overall reduction of stress. So one of the other things that I do in physical therapy is I help people get out of pain, which reduces their symptoms. And then I absolutely teach them about stress management. And some of that is education, but a lot of it is hands-on. So I am, doing manual therapy techniques to help people get relaxation in their body. And I'm doing lots of muscle and fascial work, breaking up adhesions in their bodies that stem from these abnormal movement patterns that they have. And so we break up all of those tissue issues and restore their normal spinal mobility. And then these patients often feel like, I do tell people that they're coming in for a full body makeover, and I'm not joking when I say that.
Yes, I agree with all of that. And you, to let our audience know, you are not just a physical therapist. You mentioned, craniosacral, which goes with some physical therapy, but not all physical therapists are created equal. And you go above and beyond with things like Reiki and yoga and some of the other more holistic approaches to
lymphatic drainage. That is important as
lymphatics. So you go above and beyond to treat the whole patient, which is what, as you all know, we strive to do with 360 Pelvic Health. We want to treat the whole person and not just the one dysfunction. We want to peel away those layers so that patients can live their best life. Would you care to comment and let everybody know what else it is that you do that you can offer should somebody want to reach out to you?
Oh, absolutely. So I will include a website link to my website if you're interested in getting in touch with me. You can also follow me on Facebook and LinkedIn. I post videos there. I also have a Facebook group that you can join for my business Facebook page. And that is a group mainly for people who are really interested in tackling pain that is causing them some kind of dysfunction in life or disrupting their ability to live like a full life because they're dealing with this pain. So I consider myself a pain management specialist first, and my subspecialty is pelvic health. So whether you're dealing with chronic pain or a pelvic health issue, you're more than welcome to join my Facebook group.
Thanks so much, and everyone, look at the link on the bottom of your screen. Get in touch with Tomiko if you have questions. You can always send them to me, and I can direct them. But we will be talking more about pelvic pain and chronic pain issues in forthcoming episodes of the Ask Dr. Crites series. So, Tomiko, thank you so much for joining me today. And as always, everyone, thanks for letting 360 Pelvic Health help restore your confidence.